Okay, thanks, Trevor. I don't have any more questions right now.
Okay. Got a couple questions from Facebook I wanted to get to. The first, I don't know if Commissioner Shelton wanted to address this. I just saw the latest press release from Sergeant Dusler regarding antibody testing coming to the county here in just about a week or so.
Yeah, I'll address that. You know, good thing about it is it's been a collaborative effort between the city of Odessa, Echd County, UTPB, Texas Tech Health Science Center, ECISD, and many others to respond to the COVID-19 pandemic in our jurisdiction. The drive-through testing site established by this collective effort has created an infrastructure that has been developed into a site to conduct antibody testing for our first responders. The objective of the antibody testing is to test as many first responders working within the boundaries of Echd County to determine the prevalence of the COVID-19 in Echd County. And the premise is that our first responders are in more contact with different segments of our society than any other demographic. And the antibody testing is voluntary for first responders, and the results will determine if our first responders have COVID-19 antibodies present, which indicate that they have been exposed to the virus. And the drive-through testing appointments will be scheduled between 9 and 10 a.m. and the site transitioned to antibody testing from 10 to 4. And the antibody testing for first responders will begin Monday the 11th and is scheduled to end on Friday the 15th. And the testing will be conducted at the Echd County Coliseum Building C, and the personnel will need to park on the east side of the Building C and enter the east doors. I also have a comment on the protesters out at the sheriff's office. All the protests were peaceful. They just assembled, spoke their piece to the media, and were very non-confrontational, so there were no issues there.
Thank you for that update, Commissioner Shelton. I want to toss this to Dr. Davenport and Dr. SARAVANAN too. Just to explain for somebody that doesn't really know much about antibody testing, or why is antibody testing, first of all, what is it? What does it tell us, and why is it so important in this world as we try to navigate through this pandemic?
I think antibody testing, you have to differentiate the antibody testing from the actual COVID testing itself, the PCR testing that we talked about. Antibody testing is there to identify people that have had the virus that are typically going to be in an inactive state or recovered for the most part. Again, what you do with it is probably more important than anything else. The antibody testing can be used again for tracing to help us identify pockets within the community where people have had the disease. Maybe a lot of these have been asymptomatic, to be able to help us track that. And so the number of recovered may even increase more than what our PCR testing is showing of those that have actually that have been exposed and are showing these symptoms.
Yeah. Thank you, Dr. Davenport. The only thing I want to add to that is that the antibody testing is not to establish immunity to the virus. It is exactly as Commissioner Shelton multiple times reiterated, it is to establish whether or not you've been exposed to the virus before. There is no level that's being tested. It's more of a yes or no. Do you have the antibodies or do you not have the antibodies? There needs to be levels of testing in order, and then we need to establish what the level is as the cutoff for immunity. That has not been done yet fully. So the antibody testing is just for research purposes, to plan out what our response should look like, to give us an indication of where in the curve we are, whether we've all been exposed and we've seen this virus go through our community already, or yet to be exposed, or hopefully not to be exposed. But that's kind of where the indication from antibody testing is coming in. So the differences, main differences, the COVID test, the PCR, is a swab, the one that goes in your nose or your mouth. Antibody test is a blood test. It's a blood draw that has to get sent to a lab, and that's the main differences between the two of the specimen and with the result. The COVID test, the PCR, is yes, you have the disease, or no, you don't have the disease, and the antibody test is yes, you've been exposed or you've never been exposed.
Commissioner Shelton, we know that there's already private physicians' office that are doing these antibody testing, and just like when they do a test for COVID, and they have to report to the health department, are they reporting any of these antibody testing results to the health department so they can start working on that research? Do you know?
You know, I don't know, Trevor, exactly where they're going to report those to, but I would assume they are.
So the antibody testing is not required to report to the health department.
Okay.
It is not a reportable test. It is more for public health to help understand what the prevalence in the community is, but it's not like a, you know, there are certain STDs that are considered reportable tests, and COVID now is one of the reportable tests. Antibody testing is not one of those.
But the results would be needed to be gathered so that they can make those decisions on what to do with the results.
Right.
Any other questions?
Yeah.
To time us out today, I'm going to read from Matthew 19:26 that says, Jesus looked at them and said, with man, this is impossible, but with God, all things are possible. And I think a cure and safety for all of us is possible through our Lord above. So thank you, and y'all be safe and wash your hands, and happy Nurses Day.
Thank you, guys. We'll see you back here tomorrow.
Thank you.